today I'm going to talk about one of UNM's grand challenges, child health, and why I believe that it deserves attention on the local, regional, national, and global levels. The younger generations of children are vitally important for our futures, and they deserve the access to life-saving treatments and other health resources. The World Health Organization defines child health as having access to economic well-being, family and community, health, and education. Some overall statistics from the World Health Organization states that in 2016, over 250 million children were not able to reach their full physical or physiological development, which is around 43% of children across the world. Additionally, in 2019, over 1 million children face abuse or neglect from parents or loved ones. Although there are many other challenges that face the world today, it is vitally important that we ensure that the children of our future generations have access to resources and treatments that they need to be successful and to have adequate health and well-being. Child health in New Mexico is the worst across the entirety of the United States of America, as New Mexico ranks top 10 in poorest states. Additionally, it ranks 50th in overall child health and well-being as of 2024, according to New Mexico Kids Count. As you can see on the screen, there are several different factors, like I stated before: economic well-being, health, education, and family and community. And New Mexico ranks 48th in economic well-being, 50th in education, 44th in health, and 49th in family and community. All of these things are vitally important for a child to have adequate health and well-being overall, and they all need fixing. To do so, we can prevent things like this from occurring by creating programs such as financing programs to create lower housing costs for families, after-school programs to assist learning in the younger generations and younger children, and having increased access to healthcare and other health resources. And lastly, having programs on the familial and community levels that assist in relational challenges and things like that, like therapy. Child health well-being across the United States is less terrible than child health and well-being across New Mexico, but it does rank worst in educational programs. So things that we can do to fix this is having after-school programs or a national online educational program that could be put into place to mitigate things that children struggle with educationally, and having other learning opportunities that assist them in succeeding on the academic levels. Challenges with education in younger generations puts at risk the future of America, as they all will one day enter the workforce. So we want to be sure that they are able to do so. So that's an important thing that we'd like to fix. Additionally, child health on the global scale is also incredibly terrible as far as health is concerned. Children have the worst access to healthcare and other health resources. For example, Sub-Saharan Africa has the highest mortality rate in children across the entirety of the world. And in some places in Sub-Saharan Africa, they face as many as 15 times higher the mortality rate in children than other first or second world countries or states or countries with higher income. Children in second and third world countries are most affected by this, and diseases like malaria, respiratory ailments, diarrheal diseases, malnutrition, measles, and other things like that, which they all need access to healthcare to treat and currently don't. So things that we can do to help this is fund healthcare networks in these countries, and things like pop-up clinics, nutrition classes, and other healthcare resources that they all desperately need. So in conclusion, Child health and well-being is perhaps one of the most pressing issues that we face as a country and world today, and it's in dire need of fixing. And we can all find ways to address these issues, even if they're just on the local levels. Things that we can do is set up food banks for children or after-school programs, like I was mentioning earlier. And we can even set up fundraisers for things across the world globally. And so we can all be a part of helping to address this issue of child health, and it is something that every child on all levels, local, regional, national, and global levels, face daily, and it's something that really needs to be fixed. So thank you.